Hello everyone, welcome to my channel. I am physiotherapy student. So shall we start a new topic in pharmacology, that is pharmacokinetics. So what is the meaning of pharmacokinetics? It means what bodies deals to the drug. It means what the body does to the drug. That is the short form. So it describes the time courses of drug absorption, distribution, metabolism, and excretion. So that all of the things are happening inside the body, and what body does to the drug. So that is the absorption, distribution, metabolism, and excretions. The whole process are happening in the body by the after the entering of the drug into the body. So first action is to be absorption. So movement of drug from the site to administration into the systemic circulation. It means after the drug enter into the body, it means whenever you have like taken like oral route, sublingual route, intravenous route. So next part is to be going to the systemic circulation. It means the drug enters into the bloodstream for going at the end of the targeted organ. So first enter of the drug into the body, and after that it will goes to the systemic circulation who reached out to the targeted organ or cell. So factor affecting absorption. So what kind of factors that affect the absorption will be delayed or not happen? So route of drug administration. So oral route, intravenous route, muscular route, or like subcutaneous route, that are the drug administration route, or inhalation topical route is to be also. So oral route is like delayed, so the action and first metabolism going over that place, and the intravenous or intramuscular or subcutaneous is directly into the muscle, or like in subcutaneous or intravenous, so they can directly reach out to the systemic circulation. So next is to be blood flow. If the blood flow is not appropriate, or like in not adequate amount is to be flow, so there is to be chance to the reached out to the targeted organ is to be slow. Surface area like intestine and stomach. So if blood is taken from the oral route, so there is a chance for like intestine and stomach is irritable, or like so the high alkaline medium and drug is like dissolved on that place, so there is a chance on that place if you are taking medicine by oral route. Lipid solubility. There is another factor, like some drugs are lipid soluble and they are absorbed better in lipids. So there is a one more factor. If the medicine are like dissolved into the lipid, so they can easily bind with the cell, and if they can't dissolve into the lipid, so there is a like difficulty to goes and discharge out to the systemic circulation by a extracellular matrix to intracellular matrix of different kind of cell, or like intercellular matrix of the systemic circulation. So there is a lacking of that things. Next to be pH and ionization. So potential of hydrogen of the drug into the body is it is a barrier of that to reach out to the systemic circulation. If there is pH is different, so like systemic circulation blood is not like capture the drug, so there is like one barrier, or like ionization. So weak acid absorbed in the stomach, weak bases in intestines. Like if medicine have like weak acid, so they can absorb by the stomach, and if they have like weak bases, so they can absorb by the intestine. If they're high acidic and high basic medium, and they're coated, the coating of the medicine is too much, the cellulose or phthalate coating of the medicine, so there is stronger, so there is probability to not dissolve into the intestine or like stomach. So there is one more matter. Geriatric emptying time. It means gastric emptying time. It means if you are taking medicine like after the meal, like just after to the meal, so there is a chance to like delayed for the absorption of the drug and delayed for reach out to the blood into the systemic circulation. So there is a chance, there is one more factor for affecting the administration or into the reach out to the targeted organ of the drug. And there is a presence of food. If the food is present in our stomach and you have taken immediately a drug into the body, so there is a chance to delay so the action of the drug into the body. So you can take half an hour after that you have to take a medicine of the meal. Drug formulation. So some anti-coated or sustained release are drug, or that is. So what is the meaning of sustained release? There is a drug who have like coated with phthalate and cellulose. So there is appropriate medium, or like some medicine are easily absorbed in alkaline, some media are easily absorbed in basic. So it's depend on the outer surface or coated of the tablet. So that is the coating of the tablet. And sustained release means the release of the different medicine over the 24 hours or like 12 hours. It depends on the medicine how much there is capability to sustain their molecules into the body. So that is the drug formulation. Next is to be bioavailability. It means the drug after into the body, how much time taken into the systemic circulation, and this environment of the body is appropriate of the drug or not. It means the fraction of administration of dose that reaches the systemic circulation. It means how much time taken of the drug reaches to systemic circulation. It means intravenous route is 100% of bioavailability, because you are injected the medicine into the intravenous route, so it will be directly like reach out to the systemic circulation, and it will be reduced first pass metabolism. What is the meaning of first pass metabolism? It means there is a liver or like stomach, they reduce the action of the any medicine or slow their action. So the medicine is directly injected into the body in intravenous route. So the first pass metabolism is not showing on the intravenous route or like intramuscular route. So 100% bioavailability is present in our in intravenous route. So reduce the first pass metabolism in the bioavailability intravenous route. Next is to be blood flow. So increase blood flow, increase absorption of the drug, or if like you have patient who have like a shock patient, so you have like ischemia on that place, so there is chances to decreased of the absorption of that time. Surface area. So larger surface area, the better absorption. Like small intestine absorb most of the drug. It means there is a large surface. Intestine have like 3 meter, 3 meter or something like that, the distant diameter. So there is a large chance to some drugs and good nutrition absorbed by into the small intestine on that place. So pH. Weak acid absorbed in stomach as aspirin. Like there is a one medicine which is aspirin, so there is a weak acid present on that plate, so they can easily absorb into the stomach. Next, food may delay the absorption, like iron take with milk absorption. Like it will be like you are taking medicine iron with the milk, so they can reduce the absorption if you are taking from the milk. Next part of the pharmacokinetics is distribution. So movement of drug from blood to tissue. It means first we have studied into the previously, the drug is entered to the oral route, intravenous route, or subcutaneous route, and inhalation route. Next is to be drug after they reach out into the systemic circulation, how it will be like goes to the targeted organ, like distribute the different targeted organ. So we can study here. So fact is, now we are studying the factor affecting the distribution. What the factor affect the distribution of the drug delivery into the targeted organ? So first is blood flow. So if brain, liver get more drug, anesthesia. Like blood flow is high, so high chance of absorption. If blood flow is reduced, lower chance of drug absorption. Like there is a one factor, anesthesia. So sometimes blood flow is normal, so like normal, so we can apply the injection on that place. So an anesthesia, so patient get easily anesthetized over the place or over the skin on that time. Plasma protein binding. So there is a factor, if blood plasma is directly absorbed the medicine, so there is a chance, so they get reduced or slow action on that time, or like reached out to the targeted organ. So there is a plasma protein binding. Lipid solubility. Already you have saw that aware about that lipid solubility. If drug is soluble or like make a bond to the drug or lipid, so they can easily reach out into the intracellular matrix. Also in brain, like BBB, blood brain barrier, that is the presence in our brain. So what is that? The blood brain barrier is cerebral fluid. So the enter into the brain, the crossing of the blood barrier, what is that? So cerebral fluid, it's very difficult. So diazepam is their medicine for relax or analgesic effect, so that they can easily reach out to the brain to cross the blood brain barrier, which is the cerebral spinal fluid. Body fat. Obese patient stores lipid drugs. Like body fat is sometimes they can chance to store some drugs for the further reaction showing. So that is the one more factor. Placental barrier. So some like pregnant women taking the medicine, so reached out to the targeted organ, it is to be baby for like nutrition or like different magnesium, iron, potassium, reach out to the babies. So there is a placental barrier is over there. So some medicine or like nutrition not reached out to the babies because placenta, so that think about it is like not suitable for the baby. So there is one more barrier for, so it is directly inserted into the intrauterine fluid of the baby for directly reach the drug into the baby. So already you have a study about the bioavailability in the previously. So bioavailability we are studying previously. What is that? A fraction of administration drug that reaches systemic circulation is unchanged from literally present in our systemic circulation or not. So that is the meaning of bioavailability. So if you are taking intravenous route, so 100% bioavailability. If you are taking the oral route, there is a chance, or 100, it means 60-70% chance, 100% chance the reduction of the bioavailability of the drug, because there is first mass metabolism, GI irritation, absorption of the intestine, or some absorption of the small intestine, some absorption in the big intestine. So there is a chance to reduction their action or slow action to reached out to the systemic circulation. So there is a one factor. Oral drug reduced first pass metabolism, also reduce their action. Next is to be metabolism. It is the third part of the pharmacokinetics, also known as biotransformation. So metabolism is a chemical alteration of the drug in the body, mainly to make them more water soluble for excretion. It means now medicine or drug reached out to the targeted organ, and after that they will show the action or show the analgesic effect over the targeted organ or cell. Now it will be get converted to the more water soluble for excrete out into the kidney or eliminated organ for the excretion. The site of metabolism like liver, major. Second is to be kidney, lungs, plasma. So there is a part, there is a organ to excrete out to the drug. So phases of drug metabolism. First phase, reaction, non-synthetic. It means there is a happen what some medicines are oxidation reaction. They can excrete out by the oxidation reaction. Some is to be reduction and excrete out by that. Some is just to be hydrolyte and reach out to the kidney and eliminated by the eliminated organ. And enzymes involved like cytochromes, P450, example diazepam metabolism. Diazepam is like we will be taking the headaches, and there's metabolism is like oxidation reduction and hydrolyze and like excrete out by the kidney. So that is the metabolism of diazepam. Next phase is to be reaction and synthetic. First phase is to be non-synthetic phase. Second phase is to be synthetic phase. So conjugation with endogenous substance. It means the drugs excrete out with the endogenous substances like glucuronidation. So there is a one example, glucuronidation. It means this is the factor for excrete out the medicine or drug. Or there is also sulfation or acetylation. So this is the method for excrete out the medicine. So what is the meaning of first pass metabolism in the body? So metabolism of drug in the liver and intestinal wall before the reaching of systemic circulation. The action is to be slow before the reaching of systemic circulation or the targeted organ or the cell. So that is the meaning of fast pass metabolism. So the paracetamol, nitroglycerin or morphine, these drugs are taken by the mouth and their first mass metabolism is to be slow. So their action is to be reduced. So that is the metabolism. Next is to be excretion, last part of the pharmacokinetics. It is the removal of drug and their metabolites from the body. So now a drug is entered to the body, reached out to the targeted organ, so the action to the targeted organ. Now it's time to excrete out or eliminate out into the body because their action is to be happen. So what we can there is present, why they are present in the body. So it's time to excrete out. So that is the excretion last part. The route of excretion, the renal excretion, kidney, most common of the part. Mechanism. Glomerular filtration, you have studied in previously. Glomerular filtration, that the drugs reach out to the glomerulus and their tubular circulation and wash out to the sodium potassium channel into the cell, and tubular reabsorption. Some sodium or potassium will be absorbed into the tubular, and there is some potassium or there is unwanted ions, they will be excrete out. Example, paracenyl and aminoglycosides. Some ions, some examples are there for excretion is to be there. So biliary excretion, what is the meaning of biliary excretion? The drug excreted in the bile, in feces. So some drugs are absorbed in the bile juices and they will reach out into the fish anus and excrete out by the feces. Maybe undergo enterohepatic circulation. It means there is not reached out to the systemic circulation, they can excrete out to the via anus. Next part is pulmonary excretion. The pulmonary excretion, it means there is goes to the pulmonary artery and excrete out to the lungs by exhalation. So there is a volatile substance. The sound, like example is alcohol. They can excrete out there. Sometimes you have drink alcohol, so there is one yawning or sensation or goosebump sensation. You have exhalation on the time, soaring exhalation. So they can excrete out the alcohol into the body. Other route is to be sweating. The drug is excrete out by sweating. There is to be saliva in presence in our mouth, and there is a breast milk for chances to excrete out some medicine or iron or drug by the breastfeeding into the child for reached out. So that is the excretion. So that is the completion of pharmacokinetics. Thank you.